Hi, good morning, doctors. Today we are on our 35th day of reading Oxford Handbook of General Practice. I'm Dr. Sesha, your study buddy, and we are preparing together for MRCGP International Exam. And we are at page number 614. Topic is Dermatology, Chapter 16, Skin Changes Associated with Internal Conditions. Systemic conditions associated with skin changes. Addison's disease causes pigmentation, vitiligo. This pigmentation will be even in the palmar creases. It can also cause vitiligo with association with other autoimmune disorders. Cushing's disease, pigmentation, hirsutism, striae, acne, truncal obesity, moon phases and buffalo hump. Diabetes mellitus, diabetic dermatopathy, depressed pigmented scars on the shins. Necrobiosis lipoidica, shiny atrophic yellowish red plaques on the shins, affects less than 1% diabetics but is limited to those with diabetes or who will later develop diabetes. So these are shiny atrophic yellowish plaques on the shin. Granuloma annulare is a palpable annular lesions on the hands, feet or the face. Only rarely associated with diabetes, fades spontaneously in less than 12 months, differentiate from a ringworm. Xanthomas, see hyperlipidemia, fungal infections, neuropathic ulcers, drug, drug eruptions. These are common. Withdrawal of offending drug usually results in clearance of the eruption in less than 2 weeks. Simple emollients plus topical steroids may ease the symptoms in the interim. Occasionally, patients with severe reactions may require admission for supportive treatment until effects of the drug wear off. Stevens-Johnson syndrome, erythema multiforme, we have seen in page 569. Hyperlipidemia, xanthomas and xanthelasmas. So xanthoma is a lipid deposit in the skin, may be eruptive like a rash, tendinous or plain palmar creases, and tuberous xanthomas in the knees or the elbows. Xanthelasmia, yellowish plaques on the eyelids, not always associated with hyperlipidemia. So tendon xanthomas, in the plain xanthomas, tuberous xanthomas, eruptive xanthomas, just like a rash. But xanthelasmia is around the eyelids. Inflammatory bowel disease, Crohn's disease. The skin changes associated with Crohn's disease are perianal abscesses, sinuses, fistulae, erythema nodosum, Sweet's disease or dark red plaques on the face, arms and legs, clubbing. Whereas ulcerative colitis, pyoderma gangrenosum, erythema nodosum, Sweet's disease as in Crohn's disease and clubbing. So pyoderma gangrenosum is associated more with ulcerative colitis. Liver disease. Pruritus, spider neve, erythema, white nails, pigmentation, xanthomas, see hyperlipidemia. So xanthomas, you need to see hyperlipidemia. Whereas in liver disease, pruritus is common, widespread pruritus, generalized pruritus, spider neve on the upper half of the trunk, erythema of the palmar erythema, white nails and pigmentation. Malabsorption. There will be dry itchy skin, ichthyosis, eczema and edema. Dermatitis herpetiformis seen with celiac disease. Malignancy. Acanthosis nigricans. Rare epidermal thickening and pigmentation in the flexures and neck associated with GI malignancy. Mycosis fungoides. Lymphoma that evolves in the skin, slowly progressive, becomes systemic only in terminal stages, may resemble psoriasis or eczema in the early stages. Page's disease of the nipple, page 674 we have read. Skin secondaries, most commonly breast, GI or ovary or lung or hematological. These have skin secondaries. Lymphedema, page 1025. Other conditions occasionally associated with malignancy. Flushing, generalized pruritus, hyperpigmentation, ichthyosis, dermatomyositis, erythroderma, hypertrichosis, pyoderma gangrenosum, superficial thrombophlebitis, and tylosis. So these are other conditions associated with malignancy. Malnutrition. Iron deficiency will cause alopecia, koilonychia, itching, scurvy. Vitamin C deficiency causes bleeding gums, woody edema, and perifollicular edema. Protein deficiency causes pigmentation, dry skin, edema, pale brown or orange hair, dry skin, edema. Pellagra, nicotinic acid deficiency, photosensitive dermatitis in the sun-exposed areas plus dementia and diarrhea. So there were 3 D's in pellagra. Diarrhea, dementia and dermatitis. The dermatitis is photosensitive dermatitis. Neurofibromatosis we have seen in page 552. Pregnancy. Pigmentation, spider neve, abdominal striae, pruritus, pruritic urticarial papules and plaques of pregnancy, PUP. 1 in 240 pregnancies. Pemphigoid gestations is rare. Sarcoidosis. Nodules, plaques, erythema nodosum. Sarcoid nodules, plaques, erythema nodosum will be there. Dactylitis, lupus perino, dusky red infiltrate plaques on the nose or the fingers. Nose plus the fingers. Thyroid disease, hypothyroidism, there will be alopecia, coarse hair, dry, puffy, brownish yellow skin. Puffy, brownish yellow skin. Thyrotoxicosis, pinks, again there was this orange peel appearance of the tibia, that is pretibial myxedema in hypothyroidism. So thyrotoxicosis, pink, soft skin, hyperhidrosis, alopecia, pigmentation, onycholysis, clubbing, pretibial myxedema. Pretibial myxedema is associated with thyrotoxicosis. Raised erythematous plaques on the shins, topical steroids may help. So alopecia occurs in both hypo and hyperthyroidism. Tuberous sclerosis. Adenoma sebaceum. Red yellow fibromatous plaques usually around the nose. Periungual fibroma. Pink fibrous projections under the nail folds. Ash leaf macules. White oval macules best seen under the woodlight if available. So ash green is hyperpigmented macules. This is white. Periungual is pink. And adenoma sebaceum is a red yellow fibromatous plaque around the nose. Shagreen patch, yellowish neve with cobblestone surface found on the back. So there are 4 cutaneous manifestations of tuberous sclerosis. Okay, so infectious diseases have been covered in other chapters. So there is no specific chapter for infectious diseases. Infectious diseases, here we are discussing in detail about immunization. So that's all for dermatology doctors.